First question out of my mouth, well, why should I switch? I'm doing everything just fine. My patients are doing great. The realization was that actually not everybody was doing great, and the data proved that about 20% of patients were not happy with their joint replacement. So I think that really inspired me to look at this, and I mean, really there's no comparison. Across the board, from patient satisfaction to patient's functionality, length of stay in the hospital, really everything across the board has been markedly improved when I switched to ConforMIS. One of the things that I think separates ConforMIS from anything else out there, including the other so-called patient-specific technologies, is that this is the only truly patient-specific system, and there is science behind it to prove it. It is CT-based, so you're actually referencing off the patient's bone. That's where the disease is. You're bringing that patient back to what a normal anatomic knee should look like. When you're matching J-curves, you're matching patient slope. None of the other implants are doing that. With an off-the-shelf knee, you're literally just lopping off the end of the femur. When you start your operation, you're literally cutting off that joint line in a flat cut. Well, your femoral condyles are not flat, they are offset. That's what we call a femoral offset. With an off-the-shelf knee, you're cutting off more bone than you need to cut off. With ConforMIS, you're respecting that J-curve. The J-curve, there's three of them, the medial, the lateral, and the intercondylar J-curve. By respecting that anatomy, you're absolutely maintaining the joint line the way the patient had it in his birthday suit. So by doing that, this translates into more normal function. You've got this conforming implant that in the full arc of motion, from full extension to full flexion, that contact area between the components and the polyethylene, the plastic inserts, remains completely in contact throughout that arc of motion. So since you're preserving bone and you're preserving that arc of motion, you don't see that mid-flexion instability with ConforMIS at all. Well, from the standpoint of volume, my practice, and without exaggeration, has probably increased by 30% since I've started using ConforMIS in my knee practice itself. It's been really unprecedented.